What do malignant versus benign pancreatic biopsy results mean? Imagine you're trying to understand what's happening inside your pancreas after a biopsy. When doctors take a small tissue sample from the pancreas, they look at it under a microscope to see if there are any abnormal cells. If the results say the tissue is malignant, it means cancer cells have been found. This confirms that the mass or lesion is cancerous, which often points to pancreatic cancer. The most common type is pancreatic ductal adenocarcinoma, but other types like neuroendocrine tumors can also be diagnosed this way. A malignant result helps doctors plan the best treatment, which might include surgery if the tumor is removable, or chemotherapy and radiation if it's more advanced. On the other hand, if the biopsy results are benign, it means no cancer cells were detected in the tissue sample. This suggests the growth is non-cancerous. Benign pancreatic lesions can include cysts, inflammatory masses caused by conditions like chronic pancreatitis or other non-cancerous growths. However, it's important to remember that a benign result doesn't always completely rule out cancer. Sometimes, the biopsy might miss cancer cells because of sampling error or if the tumor is very heterogeneous. That's why doctors may recommend additional tests or even repeat biopsies if symptoms or imaging studies still raise suspicion. Biopsies are usually performed when imaging tests like CT scans or MRI suggest a mass but don't provide a definitive diagnosis. If the tumor is unresectable, meaning it can't be surgically removed, a biopsy helps confirm whether it's cancer before starting treatments like chemotherapy or radiation. Sometimes, if imaging strongly suggests cancer and surgery is planned, doctors might proceed directly to surgery without a biopsy, especially if the risks of biopsy outweigh the benefits. Some benign masses, such as serous cystic neoplasms or inflammatory lesions, generally don't spread or become cancerous, but they might still need monitoring or treatment if they cause symptoms. While biopsy procedures do carry some risks, like bleeding or inflammation of the pancreas, they are generally safe when performed by experienced specialists. In summary, a malignant biopsy result confirms the presence of pancreatic cancer and helps guide treatment options. A benign result indicates no cancer was found, but doctors may still need to watch the lesion closely or do further testing if suspicion remains high. Understanding these results is key to managing pancreatic health effectively. Always consult your healthcare team for personalized advice and interpretation of your biopsy results, as each case is unique and requires careful evaluation.